Welcome to our partners and colleagues of Gulf Coast Community Foundation. Hello, everyone. This is Lori Hubner. I am an invested and credible consultant with Gulf Coast, but I'm also an independent human resources consultant. Gulf Coast has engaged me to help design and create some webinars to help you and your organizations work through all of the human resource policy implications during this really unprecedented time in our world. And we're all facing new policies, new practices, new ways of working with our employees, and new laws that are being approved by the government at a pretty rapid pace. Those of you that may be familiar with laws that have been passed by the government in the past, they often, with very good intent, pass a law, but then what happens is they haven't really sorted out how to operationalize that law in an organization. So there's definitely a trial and error period often when you're trying to implement new regulations that are passed. So this is our first, and I'm going to move to our first slide. And this is our first of 4 webinars. This first one, I'm going to focus on the Families First Coronavirus Response Act. But we also have 3 other webinars that we're going to share with you very soon. The second one is best practices, policies, tips and clues for employees working remotely. The third one are HR policies that have an impact during this time and that you really do need to pay a little bit more attention to than normal. And those are policies like workers' compensation, OSHA, HIPAA, I-9 documentation, layoffs, recalls, furloughs. What is all of that? And then last but not least, we're going to have a webinar on employee engagement and productivity. And this is a lot about how do you communicate with your employees consistently during this period of time so that they feel safe with the information that you're sharing. How do you let employees know what does good look like during this period of time? It may be a time when you need to pull out your performance plans and revise your goals and objectives. It may also be an opportunity to work on some of those big ideas that have been sitting around on everyone's desk. So Gulf Coast is committed to helping you navigate your organizations and your employees through this. And these are the webinars that we will be offering soon. They are each 15 to 20 minutes in length, and they're designed so that you can access this information at your convenience. So let's dive into the agenda for this first webinar. Again, it's focused on the Families First Coronavirus Response Act, also known as HR 6201. In the rest of this webinar, I'm going to refer to this act as the Families First Act, because honestly, that's a mouthful. So Families First Act. And the Families First Act has 4 key provisions. The first one expands Family Medical Leave Act to organizations with 500 or less employees. What's important about that to know? The vast majority of our nonprofits in this region have less than 50 employees, never mind 500. And the current Family Medical Leave Act legislation has a threshold of 50 employees. So the vast majority of our nonprofits have no experience with the current Family Medical Leave Act, never mind this expanded one. So this is important to get knowledge about this so that you could implement this appropriately for your employees, because it is designed to help your employees and to help you through this. The other provision is emergency paid sick leave. And then finally, payroll tax credit, and then a mandate for group health plan benefits, which obviously I'll be going through each one of these provisions in some more detail. Some are a little longer and more complicated than the others. So just a couple caveats. This document that we're sharing with you and any subsequent FAQs that we post on the Gulf Coast website are really intended to provide you with general information to help you work through this constantly changing and evolving situation. It, however, does not constitute legal advice on this topic. I am not an attorney. I'm an HR professional, And I think we have some really great tips and clues here to help you implement these new acts in your organizations. But again, this is not legal advice. Moving on to a little bit more about the Families First Act. It was originally signed into law on March 18th. So that's pretty recent. We are continuing to get guidance and direction from the Department of Labor and from the Health and Human Services organizations about how to implement or execute these acts. In the meantime, you as an organization have situations right now. It's not as if we all can have the luxury of waiting for all of the guidance to come. So the only caveat that we're sharing with organizations is that we must rely on a good faith interpretation of the Act's text. And so I am following along kind of in that spirit through our next several slides. Couple important points about the Families First Act. There are two provisions there that have significant financial implications for your organizations. In fact, so many of my nonprofit clients that I've spoken to over the past couple weeks have said to me, wow, I mean, isn't that great that the government is really focusing on smaller employers? Isn't it great that they're providing these provisions? But how the heck am I going to afford that? I'm worried about how to keep my organization running operationally. I'm worried about whether or not I'm even going to be able to keep my employees on staff, never mind all of these additional costs. So there is an answer to that coming on the next slide, but I wanted to upfront profile what are the two biggest hits financially to your organization. The first one is up to 2 weeks of sick leave, emergency sick leave, which is split up in a couple ways. The first way is it would be full pay for your individual employee and 2/3 pay if they were caring for a family member. And there are certain conditions which I'll review that have to do with illness, quarantine, or school closures. The second one with significant financial implications for you is the expansion of the Family Medical Leave Act up to 12 weeks. The first 10 days being unpaid, and then up to an additional 10 weeks at 2/3 pay. I'm going to spend a little more time on that, but just up front, if your radar's up and you're saying, oh my goodness, great that they passed these laws, but how the heck am I going to afford it? I think I have some answers for you on the next slide. So just to recap, this was signed on March 18th, but goes into effect on April 2nd and is intended to expire on December 31st, 2020. So by the end of this year, this will be over, hopefully. This particular coronavirus Families First Act will have expired, and it doesn't appear there's any retroactive application. So what that just basically means is it's effective April 2nd. So if you were dealing with employee situations prior to that, they actually weren't covered under the Act. But what I mentioned on the previous slide is, wow, as a small organization, you're like, how am I going to afford this? Well, this law does interact with the recently approved CARES Act. So let me take a moment and talk about that. CARES, C-A-R-E-S, stands for the Coronavirus Aid, Relief, and Economic Security Act. That was just approved on Friday, March 27th. That is a completely separate law than the Families First Act. So two different pieces of legislation, both that are approved. This first piece of legislation that I'm spending more time on today, the Families First Act, did put a financial burden on organizations to cover some of the provisions, specifically, as I mentioned, about the expanded Family Medical Leave Act and about the emergency sick leave. However, the way this interacts with CARES is because the CARES Act actually provides relief to small organizations financially. So within the CARES Act, as a small organization, you can apply for what ends up being basically a forgivable grant via a loan through Small Business Administration to cover things like payroll, benefits, if you offer them, facilities, and other operational kinds of costs to keep your employees on the payroll. Seems kind of unusual. I've got to say, as an HR professional, the idea of keeping employees on a payroll that may not be currently working, but this legislation that's being passed is incenting you to actually do that so that employees stay employed during this really, really critical time. So this particular webinar is not about the CARES Act. Gulf Coast Community Foundation will be offering a webinar about it, but it's got a very important connection to the Families First Act, because if you're wondering how the heck you're gonna afford it, you're gonna be able to afford it by implementing provisions of the CARES Act. Okay, hopefully that all makes sense to y'all. So again, let's go back to what are the key elements of the Family First Act for employers. So I've already mentioned the FMLA expansion, the paid sick leave, payroll tax credit, the group health plan benefit mandate. So now I'm going to dive into each one with a little more detail. And we're going to start with the Family Medical Leave Act expansion. As I noted earlier, all employers with fewer than 500 employees are covered under this act. In terms of who of your employees are covered under this act, as long as they have been on your payroll for 30 calendar days, they are eligible. They are an eligible member of your organization, and they are eligible to implement the Family Medical Leave Act expansion regulation to their benefit. And as an organization, you're required to support them through that. The covered leave purposes, though, are very, very specific. Those of you that may have a little insight about the Family Medical Leave Act, the broader one that covers employers that have 50 or more employees, might know that there's multiple types of situations that are covered under that act, multiple types of circumstances, many ways that that can be implemented in an organization. This, however, is very specific, and the covered leave purpose is to care for a child or children, obviously, under the age of 18 of an employee. And specifically, if those children's school or place of care has been closed, or the child care provider is unavailable due to a public health emergency, defined in this case as the coronavirus. Some questions that might come to your mind is, well, I have stepchildren, I have adopted children. I mean, what's the definition of a child? And I would say the legal definition of a child would include all of us. Stepchildren, adopted children, biological children, those are all covered under the definition of a child. And this provides up to 12 weeks of job protected leave. That's an important word, job protected. I'm gonna cover that in another slide or two. The compensation that as an employer you are obligated to cover is set up in this format. So initially the first 10 days of leave, now remember this is 12 weeks of leave. So let's call this the first 2 weeks of leave and or 10 days. There's no pay under this Family Medical Leave expansion. That is a 2-week unpaid period of time. However, the employee could voluntarily request that if they're eligible for other paid time off under your policies and practices, or they could also voluntarily request that the emergency sick leave, which we're about to talk about, could be applied to that original 10 days. Just know that you can't require the employee to take that time during that first 2 weeks, but the employee can voluntarily choose to have it applied. That's an important point here. Also then, after that first 2 weeks expires, then an employer is obligated to pay 2/3 of the employee's regular rate of pay for the number of hours they would normally be scheduled, capped at $200 a day and $10,000 total. So let me repeat that. Regular rate of pay for the number of hours they would normally be scheduled. Another important point, full-time employees are generally scheduled to work 40 hours a week, and their pay is based upon that. Part-time employees could be 35 hours a week, 30 hours a week, 20 hours a week. So you are not obligated to cover part-time employees at 40 hours a week, only at what the number of hours they would normally be scheduled to work. Okay, so important point there. I mentioned earlier that this job protected piece is important, and so let's talk about that now. This Act expansion also allows for reinstatement to their position after the leave. So it obligates you as an employer to return the employee to their position. Another important point. However, there is an exception. There's an exception for those employers that have fewer than 25 employees, but a certain condition has to be met for you to implement that exception. And that condition would be if, as a result of this economic downturn, that you've had to reorganize and that job is actually eliminated and simply does no longer exist. If that circumstance does occur, then you are still obligated to make a reasonable effort to return the employee to an equivalent position if available. And if that isn't available, then the employer is obligated to make efforts to continue to contact a displaced employee if any position comes up within a year of when they would have returned to work that they would be qualified for. Just remember that whenever all of these terms are placed, you still have to be qualified for the job in which you do. You still have to have the skills and the experience for it. So somebody wouldn't expect, or nobody would expect, that you would return an accountant to a manufacturing job in a plant, or you would return somebody who works in safety to a marketing and communications position. Of course, if they had the skills and the talents to do the job, then maybe they would be qualified. But generally, just always remember throughout this whole process, you're talking about qualifications and skills as well. So that pretty well summarizes the expansion of the Family Medical Leave Act. Let's move on to emergency paid sick leave. Again, covered employers with fewer than 500 employees. That is going to be the vast majority of our nonprofits in this region. And all employees are covered. Doesn't matter how long they've been employed. They could have been employed for one day. And as of April 2nd, you could have hired them on April 1st. And the law goes into effect April 2nd, and they are covered. You can, though, exclude employees who are healthcare providers or emergency first responders. So there is a bit of an exclusion there as well. I'm going to spend a little more, this is a little more specific. So there are, again, specific covered leave purposes. And the first three, 1, 2, and 3, are about the individual employee. The next 3, 4, 5, and 6, are about caring for a child or a dependent that is experiencing these situations. And the rates of pay are different. The rates of pay for this emergency paid sick leave for the purposes 1, 2, and 3 are covered at their full rate. And if it's a part-time employee, at what they would normally have been scheduled. If it's for circumstances or purposes 4, 5, and 6, the rate of pay is at 2/3 pay. Yes, I know, lots of complications with payroll, lots of calculations to be done, but that's the law that's been passed. And I'm certain that your payroll companies are geared up to help you deal with this as well. So those first 3 situations about the employee, the individual employee, is when they are quarantined or isolated, subject to an order, when they are advised by a healthcare provider to self-quarantine because of concerns of COVID-19, or when they themselves are experiencing symptoms of COVID-19 and are seeking a medical diagnosis. So obviously, of course, you would prefer they're not in your workplace. You would prefer they're doing the right thing and seeking testing and treatment. And those employees are covered up to 80 hours, full-time or part-time, if it's their regularly scheduled hours, um, under the emergency paid sick leave. These next three conditions now have to do with one of your individual employees caring for someone else that may be quarantined or isolated, that may have been advised by a healthcare provider to self-quarantine, that may be also experiencing symptoms of COVID-19. Could also be for a child whose school or place of care is closed, or when the employee, and this is the big gray condition, when the employee is experiencing any other substantially similar condition. So a lot of gray in that last statement, a lot of interpretation and good sense, good common sense that we will need to apply to that as organizations. So the actual duration of the leave, full-time employees are entitled to 80 hours, as I mentioned earlier, and then part-time employees are entitled to sick leave equal to the amount of hours worked on average over a typical 2-week period. So again, a couple of important points. You may only be tracking your part-time employees on a weekly basis. You really need to look at 2 weeks of working history to develop what that amount of time is for your part-time employees. So again, the rate of pay has to be at the employee's regular rate of pay for conditions 1, 2, and 3 on the previous slide, and at 2/3 of their rate of pay for conditions 4, 5, and 6 on the previous slide. Now, just to complicate things a little bit further, the pay is capped at $511 a day or $5,110 for reasons 1, 2, and 3. And the pay is capped at $200 a day and $2,000 total for reasons 4, 5, and 6. A little bit complicated. Pay attention to that. That's why I spent some time on the previous slide on the 6 different conditions. 1, 2, and 3 are about the employee and has greater advantageous financial benefits to the individual employee. 4, 5, and 6 are for people they care for. And that is less of a financial advantage and is at 2/3 pay and has different caps. Interaction with other employer provided paid sick leave and other paid leave. It doesn't preempt any other policies or laws that are already in place. As I said earlier, you cannot require employees to use their other leave first, but employees could voluntarily, for example, take this 80 hours or 2 weeks or 10 days of sick leave pay and apply it to the first 10 days of the expanded Family Medical Leave Act. Sick leave will not carry over. That's provided under this act, and it is expected to expire on December 31st, 2020, just as the Families First Act overall is expected to expire then. There is going to be a notice that the government is requiring that every employer posts in their workplace. The notice is not available yet, so keep your eye out for it, Google for it, and I will talk to Gulf Coast and we'll be sure to include a link on the Gulf Coast website when that poster does become available. So now I'm going to move on to the last 2 provisions. The payroll tax credit applies to both the emergency FMLA expansion and the emergency sick leave. And this is another way for you to get some financial relief from having to observe these new policies and laws with your employees. It gives you a dollar-for-dollar credit for sick leave and paid FMLA wages against the employer portion of Social Security taxes. Refunds are possible. There are some limits. Talk to your payroll company. They will be up to date and ready to implement this on your behalf as well. Finally, the health plan benefit mandate. So this is what this is really about, is making sure that the diagnostic testing related services for COVID-19 is covered at 100%, that there are no deductibles for this testing, that there are no copays for this testing, and that group health plans, or if you're in a self-insured and a self-funded medical plan, that all of this testing for COVID-19 is covered. That's kind of the headline here. Examples could include, you know, if you're getting that testing through a doctor, an emergency room, an urgent care center, a lab, so on and so forth. But the real bottom line to this is there should be no deductible and no copay to the COVID-19 test. It does not apply to treatment though. This is specific to the test. There are some important resources during this period of time. I don't know about you, but I have absolutely been inundated with all kinds of information from all kinds of consultants, all with great intent, all with trying to do everything they can to help us all during this situation. But I find it really important for me to rely on those organizations that I know to be best practice, that I know to have the most current information about the laws. So these are, to me, the most important sites for you to pay attention to. One is the Department of Labor. I think they've done a pretty good job of getting the regulations out there in a pretty easily read format. Obviously, the Centers for Disease Control. If you need advice and guidance and direction on how to keep your workplace safe and what are the guidelines that employees should be following in your workplace, CDC is the place to go. And then finally, for all matters HR related, I'm relying on SHRM. Although I am a member of SHRM, SHRM is also providing a toolkit for people who are organizations that are not members to access. So I would encourage you to try to focus in on these best practice and current areas of information, I guess we would call it. So that concludes our information for today. If you have any questions, email your questions to us at i3@gulfcoastcf.org, or you could also request expert consulting support. Obviously, my background and career is in human resources, but we have finance folk, fundraising folk that are part of our consulting group that you could also request some consulting support. And we do commit to responding to your questions within 24 hours. If we need to conduct further research, we'll keep you advised, and then eventually we'll have FAQs posted on the website. So thank you so much for joining us today, and please follow the rules, follow the regulations, stay safe, keep yourself safe and your family safe, and this is Lori Hubner signing off.